Okay, welcome everyone to our October 2022 live webinar with Dr. Mulcahy. We're very lucky to have her with us. She's double board certified in emergency and integrative medicine. And she's here to educate us, share her knowledge around the subject of hormones. So this is going to be a pretty informative session. So feel free to share your questions in the Q&A box, and the chat is available for you to share your thoughts with us while we go through the webinar. So go ahead and take it over.
Awesome. Thanks, Jen, and welcome everyone. So today I'm going to be talking about an integrative approach to hormones. And before we get started, I'd love if everyone can just put in the chat box, what is the first thing you think of when you think of hormones? And you can just go ahead and write it in the chat box, and we'll visit that. Jen, you can throw out, if you want, words that are coming in. And we can move on. What we're going to cover, I'm going to initially cover an integrative approach in disease versus health balance. And then I'm going to talk about what are hormones, how do we optimize our hormones naturally. I'm going to talk about the sex hormones, which are estrogen, testosterone, and progesterone. I'm going to talk about the adrenal hormones, which are cortisol, DHEA, and Pregnenolone. And then other hormones, which are thyroid and melatonin. And then I'm going to talk a little bit about hormone testing, hormone replacement therapy, and hormone replacement therapy safety. And if you have any questions along the way, just put them in the chat box and we'll get to as many as we can at the end. If we aren't able to get to all of them, we'll save the questions and we can send out an email after. Okay, so first thing we're going to talk about is an integrative approach in disease versus health balance. So those of you who've listened to any of my webinars before have heard this part previously, but I think it's always worthwhile to just revisit it. So integrative medicine is basically the umbrella under which all forms of healing modality live. And it's evidence-based, and it includes everything, including conventional medicine, which is what most people think of with medicine, naturopathic medicine, traditional Chinese medicine, Ayurvedic medicine, you name it. So the important thing to know here is that it is evidence-based. So all these different forms of healing modality do have evidence. They might not have big randomized controlled studies, but they do have evidence. So what we're doing within integrative medicine is always evidence-based. We're trying to take the best of all these different modalities. When we look at a 35,000 foot view of disease versus health, we're really looking at the balance of our biologic systems and how robust they are, and our internal and external stressors. So if your stressors, and this is a list of stressors in all of our biologic systems. So if our stressors outweigh our biologic systems, then we get this balance where we're kind of in a disease state. And if the stressors are less than the biologic systems, then we're in a health state. And then one thing that I like to mention is when we look, the way we approach things with integrative medicine is the body is, everything's connected. In conventional medicine, which I worked in for many years, we kind of divided it up into pieces. And so, you would go to your ear, nose, and throat doctor for an ear, nose, and throat problem. You go to GI doctor for a gut problem, and they may or may not be looking at how everything's connected. So clearly, all these different biologic systems are connected. And if we look at it holistically as the body as a whole, and instead of all these divided parts, we're going to have much better success. And then I'm going to just zoom in a little bit just to briefly mention the 5 pillars of health. So social connection and spirituality, sleep, stress, exercise, and nutrition and gut health. And we've already talked about a lot of these in other webinars, and this is going to be super important as well as we're talking about hormones. So let's now move into what are hormones. So hormones are basically these little internally secreted compounds that affect functions of organs. They get transported all over the body. And they're like little signaling molecules pretty much. And they affect everything in our bodies. The organ, in order to make hormones, we take cholesterol, and then in various organs, they get converted into hormones. So thyroid, adrenals, pineal, ovaries, testes, they're all going to take cholesterol and convert it into hormones. We're going to talk more specifically about what happens in each of these organs. Hormones are super important because they're going to affect the entire body. So the little signaling molecules are going to go everywhere in the body and affect how we feel and how our metabolic processes work. They're going to impact our libido, our strength, health measures, hunger, cognition, energy and mood, sleep, pretty much everything. And important to recognize that normal hormone levels are not optimal. And this is important. If we think about, in our country right now, it's normal for people to be obese, but that's not optimal. So same with hormones. So it's normal for people to have hormone levels that are too high or too low, but that's not optimal. And what we're looking for to help support your bodies is optimal hormone levels. All right. Next thing we're going to talk about is how do we optimize our hormones naturally? How do we optimize our hormones so that we can feel good? And the way I like to look at this is like, what's the root cause? Like, why are our hormones off balance to begin with? And that's kind of a more integrative medicine approach versus conventional medicine is oftentimes more of a band-aid. So, hey, the hormones are off, let's just replace the hormones. And we do hormone replacement therapy, but I also think it's really important to focus on why are they off in the first place and how can we support our bodies to get the hormones in balance rather than just replacing the hormones. So the hormone levels are regulated by our brain and then the organs where they're produced. So I'm going to show some kind of scary looking diagrams to show how the hormones are impacting everywhere. So if you look at this diagram here, you can see that the pituitary is in the brain, and you can see that it's releasing all sorts of hormones that then go to all the different organs around the body that then release other hormones. And so it's a huge systemic process that if any part isn't working right, we're not going to feel good. And we're going to end up in a state of dis-ease. Here's another diagram that's going to show how we can intervene with hormones. And this also is a little bit of a scary diagram, but it's just kind of showing the entire diagram of how the hormones are related. And you can see in all the little bubbles there, it will show that, for example, like across the board, things like inflammation, high blood sugar, obesity are going to impact our hormones in a not positive way. So they're going to make it such that the hormones that make us feel good are not as high as they should be, and hormones that make us feel not as good or higher than they should be. And we'll get into this in more detail when we kind of get into each hormone.
Wonderful.
Anything that disrupts.
Your screen is not being shared. So if you could just go ahead and share the screen, just in case.
Has it been shared the whole time or no?
No. So now that you're discussing a diagram, if you could share the screen, that'd be great.
Oh, it should have been shared the whole time. Sorry.
No worries.
Can you, it's saying that I can't share.
Okay, so let's just make sure that you have the access to share screen. Give me just 1 second. My apologies. I have to find how to do that for you.
I think if you go into share screen, it should say like allow multiple participants to share.
Okay, I just made you a co-host, so you should be able to do it now. So go ahead and share away. Thank you.
Okay, so sorry everyone. I am wondering if I should I'm just going to run through these so everyone can see the pictures. I didn't realize that it wasn't sharing. Are you seeing this okay now?
Yeah, it looks beautiful. Thank you.
Okay, perfect. So integrative approach to hormones. We talked about putting what you first think of with hormones in the chat box. This is just a list of what we're going to cover. I think, in terms of learning, it's important to use both hearing and seeing and kinesthetic learning, all different types of learning. So for integrative approach of disease versus health, these are the diagrams that the slides that were missed here. But basically here is what we look at. If our external and internal stressors outweigh our biologic systems, we're going to have an imbalanced system, and we're going to actually go more towards disease versus health. And then the 5 pillars of health here: social connection and spirituality, sleep, stress, exercise, nutrition, and gut health. And then we talked about what are hormones. So hormones are little secreted compounds that are formed in endocrine glands that basically travel around the body to signal to all different areas in the body. and they are made from cholesterol in all these different organs. So the ovaries, thyroid, adrenals, pineal, and testes. And they affect organs throughout the entire body. I know I already went over this, but I just want to show all the pictures. So all these different areas: libido, strength, health measures, hunger, cognition, energy and mood, and sleep. And then normal is not optimal. So as I mentioned before, we want to make sure that we're optimal, not normal. Next thing we're going to cover is how do we optimize hormones naturally? So how do we optimize our hormones so that we feel good? So we want to address the root cause, not just duct tape the situation. So why are the hormones off in the first place? We can certainly replace people's hormones, but if we're not addressing what's happening underneath, there's probably other problems that are going to arise. So hormone levels are regulated by the brain and the organ where they're produced. And I'm going to show that diagram that I was mentioning before. So the pituitary is in the brain, and it's going to send out hormones that go to all these different organs in the body. And then all of those organs will produce hormones there as well. And so it's important to notice that, like, if any part of the system doesn't work well, it's going to impact us. And then here's another diagram that I mentioned before, just kind of showing the big picture of how all the hormones are related. So big picture here is, if you look at all the little blue boxes there, it'll have like a plus or minus. So for example, increasing inflammation, increased obesity, decreased ability to handle blood sugar, increased blood sugar, that's all going to cause us to kind of tip towards not having optimal hormone balance. So if I give you hormones to help your hormones get in balance, but you're still super inflamed, you're not eating well, you're not sleeping well, it's going to be really hard. We're going to be kind of working against each other. And we always say that what we do in the office or what we do in telemedicine visits is about 20 or 10% of the story. The other 90% is what you do at home. And so we want to help support your hormones to be as optimal as possible. And then anything that disrupts any of those pathways is going to affect our hormones. So if our sleep is off, that's going to impact. If our diet is off, if we're eating a super inflammatory diet, this is a diagram of the anti-inflammatory diet pyramid. But if you're eating an inflammatory diet, that's going to negatively impact your hormone. Stress is pretty much, I think, the propane for almost everything in our body. So if you think of fires as various things happening in our bodies. So in this case, we're talking about hormones. So if your hormones are out of balance, you think of it as a fire in your body. Stress is basically like putting propane onto that fire. Exercise. So exercise, much like many things, it's dose dependent. So too much exercise is not good, and too little exercise is not good. So we want it to be in kind of the perfect range where it's helping us and not hurting us. Inflammation. So inflammation, we talk a lot about inflammaging. So anything that causes us to get inflamed is going to cause us to age faster. So ideally, we want to do everything we can to decrease inflammation. Now, of course, if we get sick, if we exercise, there's lots of things that we're going to do that are going to cause us to get inflamed, and that's okay. But we want our immune system to go back into a normal status as quick as possible. This year, in the past couple of years, we've noticed with COVID, that people that end up having long symptoms, it's because their immune system doesn't regulate. So they get sick, their body's immune system upregulates, it causes inflammation, which is normal. And then instead of going back to normal after, it stays inflamed. And then when we stay inflamed, we move into areas of autoimmunity, chronic pain, hormone imbalance, all of these things. So if you don't learn anything else from this webinar other than do whatever you can to decrease your inflammation, you'll be taking home a lot. So other things, unfortunately, we live in a world right now where we're exposed to all sorts of things that disrupt our hormones, and a lot of things you might not even think of. So for example, you can see in these diagrams, a lot of our personal care products like shampoo, candles, plastics, all these things are going to impact our hormones. And so there's various websites. One is the Environmental Working Group, but there's other ones that can kind of help you to see if the products you're using are likely to be impacting your hormones. Other things, pesticides, which is, if you're not eating organic food, pretty much all of our vegetables are going to have pesticides in them. So every year they put out a list of the Dirty Dozen and the Clean 15. So I'd highly encourage that you try and make sure that for that Dirty Dozen, which are the vegetables and fruits that have the most pesticides in them, that you try and pick vegetables and fruits that are organic if they're in the dirty dozen. They're the clean 15, not as important. You can eat all organic, that's great, but sometimes it's hard to access because they don't have enough organic produce wherever you live, or it's expensive. Another thing that impacts our hormones is our microbiome. And you can see in this diagram here. So if I have a genetic predisposition to having problems with my hormones, and then I end up having a microbiome that's out of balance. I'm not going to get into microbiome huge here, but I just want to mention that microbiome is key for hormones as well. So I did another webinar on microbiome that I would recommend listening to if you haven't already. But the combination of genetic predisposition plus hormones plus the microbiome can lead to things like chronic inflammation, autoimmune disease, sickness, and all that. And so the microbiome plays into everything, including hormones. And then you can look at here as well, levels of hormones that are not optimal, whether they're too high or too low, can cause problems. And so there's a lot of issues these days with estrogen dominance, too much estrogen, partially from all the different hormone disruptors out there. And our guts are a huge issue with this. So if our guts are not in balance and we're producing a lot of enzyme that's called beta glucuronidase, it's going to cause us to keep our estrogen and not get rid of it. Too much estrogen can cause all sorts of problems, including increasing our risk of cancer, makes us feel bloated, retain fluids, all sorts of symptoms. So too little estrogen is also problematic, and we'll talk about that. But this is more to mention that our microbiome is paramount to getting our hormones in balance. And then the other thing that I want to mention is just the HPA axis is so important for our hormones. So if we look at this diagram here, the hypothalamic pituitary adrenal axis. So the hypothalamus and the pituitary are in the brain. This might look scary, but it's actually pretty simple, that our brain sends signals to our organs in our body. And if we have too many things like stress hormones, for example, it's going to inhibit hormones and make the levels lower than we would like. The other thing to notice in here that's interesting is estrogen and progesterone, various hormones can actually be used to make cortisol, which is a stress hormone. So we can really kind of get ourselves out of whack with things like stress and a disrupted microbiome. The other thing I want to mention is that women versus men, we notice a difference in terms of the microbiome with the sex hormones there. So women are more likely to develop autoimmunity, and there's a component of estrogen impacting the microbiome. And then also that women tend to have higher antibiotic resistant genes. And part of that is, unfortunately, women end up on average receiving about 2 times the amount of antibiotics that men do. And the primary reason for that is women get diagnosed with tons of UTIs. So some UTIs probably do, and that's urinary tract infections. Some probably do need to be treated with antibiotics, but probably we get over treated. And then every time we take antibiotics, it kind of drops a nuke on our microbiome. And then that is going to impact all sorts of things, including our hormones. Okay. The next thing I'm going to move on to here is looking at the sex hormones. So the sex hormones are estrogen, testosterone, and progesterone. So estrogen here is, you can see it's mostly produced in the ovaries, and some is also converted from DHEA and testosterone. And the diagram on the right here is just a zoom in of that bigger diagram that I showed. And the reason that I brought this up is to just show, again, that things like inflammation, high sugar diet, pesticides, stuff like that are going to push us towards having unhealthy estrogen metabolites. So estrogen is great. We need estrogen, but estrogen is going to get converted into other forms, metabolites that then ideally get removed from our body. And if we end up having too much input from things like inflammation, we're going to get buildup of unhealthy estrogen metabolites, and that can lead to things like DNA damage and cancer. And so the reason I show this diagram is, again, we want to be addressing all these root things and behavioral things, not just throwing estrogen at people. If I give someone estrogen and their body is naturally converting it to an unhealthy type of estrogen because of things like inflammation, it's not going to be that helpful, and it could actually be harmful. Estrogen impacts all sorts of things around the body. It's also important to note, we think of estrogen with women, but it's super protective for men as well. So it protects against heart disease, stroke, osteoporosis, Alzheimer's disease, and memory loss. And that's for men and women. It's going to protect against vaginal atrophy, urinary incontinence, and UTIs. It's going to prevent menopausal hot flashes and temperature dysregulation. It helps with balance. It helps to prevent neurodegeneration. It also helps to prevent macular degeneration in the eyes and cataracts. And there's multiple vascular benefits of estrogen as well. When we don't have enough estrogen, we're more likely to have issues with incontinence and atrophy in our urogenital area, sagging skin and breasts, increased skin wrinkles on the face, fatigue, depression, mood swings, and decreased libido. I mentioned before that there are different types of estrogen. So the main three are estradiol, estrone, and estriol. Estradiol is the primary one that does all the work, that does all the benefit. Estrone is the primary estrogen that we have after menopause, and estriol is a primary estrogen in pregnancy. On the diagram on the right here, I just want to point that the metabolites, which are the circles that I have in red and green, we want as much as possible as estrogen gets removed from our body, the excess estrogen, for it to go to the green circle one and not the two red circles. And you can see that anything high sugar diets, inflammation, pesticides, things like that are going to push us towards the bad type of metabolite, which can then lead to things like cancer. So the reason I keep bringing this up is people think about, hormones, hormone replacement therapy is causing cancer, and that's absolutely not true. It's actually protective. But if we're not doing it mindfully and we're pushing estrogen into these unsafe pathways, then certainly it can increase the risk. A couple of things that a lot of people don't know about, as estrogen levels drop, as we reach the perimenopausal and menopausal area, there's definite correlations with that and Alzheimer's disease. So as we start to have our estrogen levels drop, if we're predisposed to Alzheimer's disease, that's going to make us increased risk of developing dementia. Estrogen is also very strongly correlated with immune system function and metabolic system function. And don't worry about all the details in here. It's just showing that basically as we get older, as we produce less estrogen, it's going to impact both of those systems. And then this is a diagram I mentioned about cognitive function, but I think this is really important to look at. The black line there is kind of looking at our cognitive function if we don't have any sort of hormone replacement. And then the green line shows what our cognitive function will do as women if we do have hormone replacement. And the important thing to note is we want to start the replacement before we reach menopause. So you can see like down lower, the little red dotted lines, if we replace hormones later, like by the time we get to be 60, it's almost too late. The cognitive decline has already happened. All right, now we're going to move on to testosterone. So in men, the testosterone is primarily produced in the testes, and in women, it's produced in the adrenals and in the ovaries. This is the same little blow up of a diagram here. And it's also just showing like, hey, if we're inflamed, if we're obese, we're not going to have optimal levels of testosterone. And then on the right, you can see aromatase inhibitor. So what happens when we're inflamed, when we're obese, is our testosterone is going to convert into estrogen. Estrogen's not bad, but as we mentioned, too much estrogen can be a problem, especially if we're not metabolizing it well. So it's pretty common for people to get put on testosterone replacement therapy and then be given aromatase inhibitors. And the approach we like to take instead is like, what's causing your testosterone to convert, which is usually things like inflammation, blood sugar dysregulation, things like that. So ideally, high cortisol, stuff like that. Ideally, we're going to address those things so that you're not aromatizing as much and use more natural flavonoids, things like that, that can help to keep the testosterone from converting rather than putting you on another drug. Benefits of optimal testosterone, lots of different things: strong bones, happy, sharper mind, increased sexual function. This is obviously looking at a man, but women also super helpful. When we have optimal levels of testosterone, life is fun again. So we have increased muscle mass, strength, and endurance. It's going to decrease our fat, both subcutaneous and visceral. It increases our exercise tolerance. It's going to increase and enhance our well-being and psychologic status. It's going to improve our lean muscle mass, improve our bone density. It's going to decrease our cholesterol, improve our skin tone and collagen, improve healing, and improve libido and sexual function. It's also going to make us more healthy. So it decreases the diseases of aging. It's protective against cardiovascular disease, diabetes, hypertension, degenerative joint disease. When we do regenerative injections on people, if their testosterone is not optimal, they're not going to heal as well. It's a memory enhancer. It improves cognition. It protects the cardiovascular system, the neurologic system, musculoskeletal system, vascular system, immune system. Protects. So it's going to help us to feel good, and it's also going to give us all sorts of health benefits. We think about testosterone mostly with men, but actually testosterone hormone levels are 3 to 4 times higher than estrogen in women. So super important for women as well. All the same benefits in the previous slides for women, including improved body composition and aesthetics, increased clitoral sensitivity and orgasmic ability, decrease in visceral fat, increased collagen and skin thickness, and then decrease in wrinkles, fat deposition, and cellulite. All right, the next thing we're going to move on to is progesterone. Progesterone is produced in the ovaries and the adrenals. And again, if we have high insulin, high blood sugar, it's going to be hard to have our progesterone levels optimal. Symptoms of low progesterone are going to be anxiety, depression, irritability, mood swings, a lot of kind of mental health symptoms. Sleep is not going to be good if our progesterone is not optimal. It's also important to note that progesterone protects us from the potential carcinogenic effects of too high of estrogen. So we call that unopposed estrogen. So we always want to make sure that we have adequate progesterone to protect us. Too low of progesterone also is going to make us more susceptible to have infertility and pregnancy loss, excessive menstrual bleeding, migraines, decreased sexual interest and arousal, and decreased HDL, which is a form of cholesterol. Next thing we're going to move on to our adrenal hormones, which are cortisol, DHEA, and pregnenolone. So cortisol, I think everyone's probably heard of cortisol. It's our stress hormone. And if a bear ran into the room right now, I would want to have some cortisol going to my body so I could punch the bear in the nose and run out of here. But if we have cortisol coursing through our systems all the time, it's like our body's just trying to survive for the next 5 minutes for the rest of our life, or for days, years, months. It's not healthy. You can see all the things it does. It's going to increase your heart rate, increase your blood pressure. It's going to decrease your digestive activity. It causes all sorts of things that are not helpful long-term. Cortisol is going to largely be impacted by stress. So stress comes into the brain, into the hypothalamus and pituitary, and then the adrenal is going to produce either DHEA, which I'll talk about in a minute, or cortisol, and they're inversely related. So the more cortisol we're producing, the less DHEA we're going to produce. We're also going to produce more cortisol if we have too high of insulin or insulin resistance, obesity, inflammation, all of these things. And in general, most people are living with too much cortisol these days. It's going to cause all sorts of uncomfortable things in our body: mood swings, anxiety, changes in libido, excessive thirst, irregular periods, all sorts of things that are not comfortable. Weakened immune system, digestive issues, nerve problems. It's going to increase our sensitivity to pain. So if cortisol levels are high, we're not going to feel good. It's also going to impact our memory and our visual perception. High cortisol levels over time actually cause memory loss and brain shrinkage that we can see in pretty young people even before they notice anything. So it's super harmful to our bodies. And high cortisol is going to basically cause all other hormones to be lower. So that's a very easy, like low-hanging fruit way that we can intervene to help get hormones in balance, is to try and help the cortisol to get in balance. And that is not, you might think, well, I have a stressful life, there's nothing that I can do about that. And that's true, but there are lots of little things you can do: breathing exercises, little mindfulness things, gratitude practices. There's tons of ways that we approach things to try and get us more into parasympathetic, so we're not producing as much cortisol. The curve at the bottom, you can see the two black lines are kind of the range. We should have a normal cortisol pattern where it goes up at the beginning of the day and then goes down. So sometimes people have super high curves. This one that I show in this diagram is on the low end, but it's not flattened. This is the same diagram here, but you can imagine that blue one could be below and flattened. So too low of cortisol is problematic as well. And oftentimes if people have too high of cortisol for a really long time, they'll end up eventually having too low of cortisol. And that's going to contribute to things like anxiety, depression, cardiovascular disease, cancer and early breast cancer, fatigue, fibromyalgia, PTSD, and inflammation and immune dysfunction. Let's move on to DHEA now. DHEA is produced in the adrenals, and it's a hormone that restores anabolic versus catabolic metabolism. So that basically means that we're going to make muscles. It's going to be building instead of taking away. It's going to help with immunity. It's kind of the opposite of cortisol in many ways. It's going to help with bone density, help with diabetes and heart disease, improve mood, decrease visceral fat. It's going to help with memory, restore sexual vitality, helps to decrease cholesterol and body fat, has anti-cancer properties, and it's going to reduce insulin requirements. Estrogen, testosterone, human growth hormone also reduce insulin requirements. Something to note with DHEA. So DHEA is something that is pretty easily available over the counter. And if you look at this diagram here, the up and down here is if you just kind of buy regular DHEA that you could get anywhere these days, and it's going to increase your DHEA, and then it's going to go down. If you take some more, it'll go up and then down. The type of DHEA that we like is a sustained release micronized DHEA. So kind of over a 24-hour period, it's going to go up and then back down. And it's going to model what we do physiologically better. Other thing to note with DHEA, just as I've been mentioning with everything, inflammation and obesity are going to negatively impact DHEA. Next hormone we're going to talk about is pregnenolone. It's a precursor hormone to all other hormones. It's produced in the adrenals, and it functions as a memory enhancer and cellular repairer. We generally only replace pregnenolone with people if there's memory problems, but we do have a supplement now that combines DHEA and pregnenolone, which a lot of people really like. And you can see on this diagram on the left where the red circle is, that's where pregnenolone is. So you can, and the little star above it is cholesterol. So cholesterol makes pregnenolone, then you can see that pregnenolone goes to all these other different hormones. But important to note that most of the DHEA, testosterone, progesterone, estrogen does not come from pregnenolone. It comes from from cholesterol that gets converted in these various organs into the hormone. So you don't need pregnenolone to make testosterone or to make DHEA or to make progesterone. All right, the next thing we're going to cover are a couple other hormones, thyroid and melatonin. So thyroid is produced in your thyroid, and it's a metabolic hormone that regulates temperature, metabolism, cerebral function, and energy. It's pretty much necessary for all of our metabolic processes in our body. The thing that I want to point out about thyroid is the hormone that's actually produced in the thyroid is T4, and T4 gets converted into T3 in peripheral tissues, primarily in our gut and in our liver. T3 is an active form of thyroid hormone. So when we get Synthroid, which is a very common hormone that's prescribed to people for thyroid, that's T4. If people are inflamed, they're oftentimes not going to convert it into T3. So people might be taking T4, but they still don't feel great because their T3 levels are not optimal. Inflammation is going to prevent the T4 from being converted into T3. And we tend to prescribe a combination hormone that has T3 and T4 so that people are actually getting that active form. Generally speaking, once people get all their underlying imbalances in order in terms of like gut health, the T4 converts to T3 well. And then oftentimes also the thyroid hormone produces adequate, so you don't need to supplement it. Thyroid disease also has a relationship to estrogen, and the prevalence of thyroid disease is much higher in women. 20% of postmenopausal women have subclinical hypothyroidism, meaning it's not going to show up on labs. And thyroid abnormalities are associated with much poorer responses to any sort of standard treatments for mood disorders. We always check thyroid antibodies, and abnormal thyroid antibodies are usually going to precede the thyroid hormones actually being off by 8 to 10 years. we do a lot of injections in the neck, and oftentimes I see people's thyroid organ when I'm doing the ultrasounds in the neck, and I see the autoimmunity a lot. So, people might not realize that they have any autoimmunity. We do the ultrasound, we see that there's some changes, we have them do the blood test, and sure enough, they have some autoimmunity. Thyroid tissue under the microscope looks almost identical to gluten and casein, and casein's a primary protein in dairy. And so if your body is reacting to your thyroid, it's almost certainly reacting to gluten and casein and vice versa. So when we look at optimizing thyroid, we could just give you thyroid hormone, but if your body's attacking your thyroid, we're going to have to just keep giving you more and more thyroid hormone. Ideally, what we're going to do is get your body and your organs working optimally. Melatonin is a hormone that is produced in the pineal gland, and it's a sleep and immune enhancer. And the production and effectiveness of it decrease with age. Melatonin, everyone thinks about melatonin with sleep, but it's helpful for so many things. It's anti-inflammatory, it lowers blood pressure, decreases migraines and cluster headaches. It reduces peeing in the middle of the night by increasing stage 4 sleep. It's going to increase immune function. It's also super protective against cancer because it's a really potent antioxidant, and also increases glutathione, which is a potent antioxidant. Similar to the DHEA, most people are taking melatonin that kind of spikes up and then goes down. What we like to use is a sustained release melatonin that kind of goes slowly up and then down. And they actually did a study at UCSD that just showed that there's pretty poor standardization and bioavailability in over-the-counter melatonin products. So I get a lot of people that say, oh, I've tried melatonin before and it doesn't work for me. And probably for about 10% of people, it doesn't work. But for a lot of people, it's just that they weren't getting the right type of melatonin. Higher doses of melatonin are better for the anti-inflammatory, antioxidant. In fact, lower doses are actually better for initiating sleep. So we do a combo. Next thing we're going to talk about is how do we test hormones? So we like to do a combination of urine and saliva and blood tests. So the Dutch test, which is what you see on the left, is a urine and saliva test, and that's going to check your hormones over the day. It's going to give us more of an idea of what your hormones are doing over time, and it's also going to give us an idea of what metabolites, what direction your hormones are metabolizing in. So back to that estrogen diagram, it'll help us understand, hey, is your body getting rid of estrogen safely because it has great detoxing and it's pushing in that healthy estrogen metabolite way, or do we need to help it go in that direction so you don't end up having problems like cancer? We also want to always check your blood test for the hormones as well to make sure that they're correlating. Now, from minute to minute, our hormones are going to change. So blood test is not as sensitive because it's changing so frequently. So I like the combination of both. And then we like to retest your hormones after about 6 weeks after we start on hormone therapy, but we don't do the Dutch test again. We usually do the Dutch test at the beginning and then maybe annually, something like that. The Dutch test report, this is just page 1 of it. It's going to kind of look like this. It gives a little diagram showing where your sex hormones are, and then your adrenal hormones, and then it goes into more detail. So it gives us a lot more information. It looks at what's happening with your cortisol curve throughout the day. It looks at your metabolites, whereas just a blood test isn't going to give as much information. All right. Hormone replacement therapy. So why the heck do we worry about replacing hormones? So just naturally, not even talking about all the hormone disruptors and the things that we're exposed to in our modern lives, our hormones drop as we get older. So all of our hormones do, but in women, what causes most of our symptoms is estrogen dropping, men, testosterone. So if we look at our estrogen levels over time, you can see that, of course, they start lower, they reach a peak in our 30s, and then they start to go down. What happens as they go down? All the symptoms that we think about as perimenopausal and menopausal symptoms. Of note, all symptoms of menopause are going to be worse if we're inflamed. So when you hear about people that go through menopause and really don't have any problems, they're probably don't have very inflamed bodies. They're probably the same people that have regular menstrual cycles without a lot of symptoms. When we're having a lot of symptoms with our menstrual cycles and in menopause, it probably means that we're pretty inflamed. Men, testosterone level starts dropping after 20. So we're going to notice that pretty soon. How do we replace them? So bioidentical hormone replacement therapy is using the same chemical structure of those that are made by our body. and they're metabolized by normal metabolic pathways. And we don't have the harm that you can potentially see with chemically different hormones that can produce harmful metabolites. And we were talking about the normal metabolites, but whenever we're using synthetic medications, we can have metabolites that can be harmful. And metabolites is basically just, if we take a particular drug or hormone or whatever, our body breaks it down to get it out of our system. So what it breaks it down to are the metabolites. That's just the word for that. Synthetic hormones are manufactured with a different chemical structure than is normally produced by the human body. So, and really, they're not any better or more efficacious, but they can be patented. And that's the only reason that they're made. And so oftentimes they'll change like just one or two little bonds or parts of the structure. It's almost the same, so that then they can patent it. They cannot patent something that is identical to what we produce in our body. So Synthroid, for example, which is one of the most commonly prescribed medicines for thyroid, that's the synthetic hormone, versus things like Armour thyroid, NP thyroid, or bioidentical. So if hormone replacement is, if we have all these things happen when our hormones drop, and it's pretty easy to replace our hormones, why isn't everyone doing it? So there are some concerns over safety out there. And I think a lot of people have some misconceptions, including doctors and the media. And then both non-treatment and treatment can cause harm. So, we know if we don't have enough estrogen, it can cause problems in terms of cognitive decline. But if we have too much estrogen, it can cause problems as well. And so I'm going to spend the next little bit here to just talk about safety around hormone replacement therapy. Before jumping into hormone replacement therapy that we're talking about later in life, I just want to talk about the birth control pill for a minute. So tons and tons of women are on oral contraceptives, otherwise known as the birth control pill. And I don't really talk about the risk of the birth control pill that much. I hear people more often really concerned about being on hormone replacement therapy as they get older, but they were on the pill their whole life. So the pill causes mood issues, it increases the risk of clots, increases the risk of Crohn's disease, fungal overgrowth, thyroid dysregulation, increase in breast cancer, decreased free testosterone, which causes all the problems of decreased testosterone. So I just want to mention that this is an important thing to keep in mind. And the birth control pill also is made of synthetic hormones as well. So it's important for us to realize that there's lots of things that we're doing all the time that are harmful, and then there's misinformation about things that are actually not harmful. So when we talk about hormone safety with testosterone replacement therapy, testosterone can cause an increase in red blood cells, hemoglobin, and hematocrit. It's usually not harmful, and it can certainly be helpful because some people run on the low end, they're a little bit anemic. If someone lives at altitude and the numbers get really high, that's certainly something where you can blood donate to basically make sure that it's not getting too high, but there's no documented harmful effects here. Testosterone can aromatize into estrogen and cause elevated estrogen levels. Now, elevated estrogen levels are not necessarily harmful as long as they're being metabolized okay. Men need estrogen as well. Testicular atrophy and infertility. It's important to note that testosterone does not cause prostate cancer. It's actually protective for prostate cancer, but once someone has prostate cancer, then it's contraindicated. So that's just something to be aware of with hormones. We don't ever want to start people on hormone replacement therapy once they have cancer, but when people's hormones are low for periods of time, that increases their chance of developing cancer. Another risk is accidental transfer. So we use creams. So if someone is using a testosterone cream, doesn't wash your hands, touches a child or pet or another loved one, that can cause unwanted effects. And then it can cause fluid retention. With estrogen, there's this fear of breast cancer, but it's more from synthetic hormones and also not that protection with the progesterone. Same with endometrial cancer. That's just if people are getting estrogen, too much estrogen without progesterone. It can cause breakthrough bleeding, bloating, breast tenderness, irritability, and fluid retention. Progesterone is not absorbed that well orally, and the cream doesn't work that great either. So we kind of need to use a micronized or sublingual form. So that's oftentimes where people don't get the results they want with progesterone. It's a natural sedative. So it's kind of one of nature's way to help us go to sleep at night, which is great if we take it at night, but not good if you take it in the morning. Oral progesterone does undergo first pass liver detox. So what that means is that it's going to decrease in the liver pretty quickly. So you can do a sublingual amount that's going to get absorbed more rapidly and not go through the liver and then have fewer side effects. It is a little bit more expensive though. DHEA produces acne and unwanted hair growth in higher levels. Melatonin can cause nightmares with some people, increased dreaming. With some people, it actually doesn't seem to help them, with about 10% of people. Sometimes, although rarely, it can be overstimulating. And then with some people, it makes them really somnolent. With thyroid hormone replacement, it can cause sweating, palpitations, and tachycardia if the doses aren't right. So how do we keep people safe with all these potential risks? The important thing is having the appropriate dosage and making sure that we're pushing the pathways in the safe way to get the extra hormones out of there. We want to check blood work 6 weeks after we start therapy, and then annually, and then screening and diagnostic exams. So anyone that's on hormone replacement therapy should be getting normal exams from their PCP, just wellness exams, to make sure that there's no signs of breast cancer or any sort of other cancers. DIM therapy, I'm just going to mention briefly. So DIM is often prescribed in conjunction with hormone replacement therapy. It's going to push our estrogen towards the healthy form of estrogen. It's also going to help inhibit testosterone going to estrogen. It's going to protect against prostate problems. It's anti-inflammatory. It supports free testosterone, and it's anti-cancer. All right. So we made it through a pretty intensive talk on hormones. So now I'd love to hear, what is the first thing you think of when you hear the word hormones now, post listening to this chat? And then Jen, maybe you can read some things that people said pre and post in terms of what they're thinking of with the hormones.
Well, as we look for some comments in the chat box, the thing that first comes to mind for me is, I'm turning 46, I'm perimenopausal. Sounds like I might want to start looking into doing a more updated Dutch and considering some hormone replacements. That's the first thing that's coming up for me.
Yeah. Yep. And I think, a lot of people just, when they think hormones, they think like, oh, it's something that I worry about when I get older, but they don't really have a good understanding. So my hope is that this webinar kind of helps everyone to understand how important hormones are throughout our entire body. Are there any questions that came up?
Yeah, there was a remark about when you were going over cortisol and the idea that it is something that could really interfere with all other hormones and their production, a query on how one might reduce their cortisol.
Oh yeah, great question. So all the sort of mindfulness activities that can get you more into parasympathetic, basically anything that's going to get your nervous system more into parasympathetic is going to help to decrease your cortisol. I've done a couple webinars talking about stellate ganglion blocks and how that impacts our nervous system. So that's a treatment that we do, that's an injection in the neck that can really it's a 5-minute treatment. It pretty quickly can balance our parasympathetic and sympathetic nervous systems. Breathing exercises, gratitude practices, all those things are going to help us to push more into parasympathetic, which is going to decrease our cortisol. Good question. What else?
We also had another comment around duration of taking them. And this person was querying more of, is it something that if they did start early, like I was describing, would they stop once they started menopause?
Yeah, that's a great question. So generally speaking, as we get older, our hormone levels are going to keep declining. And so if we're starting someone on hormones at an earlier age, for example, like say it's a man who has really low testosterone in his 30s because he has been working a really stressful job, maybe in the military or something like that. That might be something where we replace temporarily. And then as we get all those root causes in balance, then we don't need to keep replacing it. As we get older, we're probably going to need to keep supporting the hormones just because we're not making them as well. But as we address all the underlying things, the hormone levels are going to come up naturally. So it's really, we like to practice personalized medicine. We don't treat everyone the same. So depending on the age of the person, other things going on, they might need to be on hormones indefinitely, or it might just be a short period of time. Good question.
Great. And sticking with the theme of timing, one person said that they were only 35 and was curious if they should get their hormones checked now or wait until they're in perimenopausal phase.
Yeah, that's a great question. So I think it's great to get a baseline. Like 35 is starting, we're not perimenopausal yet for most people. But I unfortunately check lots of people in their 30s who have hormones that are off because of stress and a disrupted microbiome, all these things. So, and if people are feeling great, it's also good to have a baseline. So I think no time is too soon to have a baseline. And then if it's off, then we can intervene to help get it in balance. Potentially, you just with all the different approaches that I talked about in terms of lifestyle and behavior. And then also, I didn't talk about this a lot, but there's lots of supplements that can help support hormones without actually doing hormone replacement therapy. And peptides can also be helpful as well. Good question.
Yeah, it's interesting. And as a Chinese medical practitioner, a very famous formula that helps is related to keeping the liver calm, which is really about calming your frustration and your anger, emotional context. And keeping in the theme of testing, so we just had that question about timing, but also we have in the chat from one of our live attendants that just threw it in now, asked about Dutch Plus being covered by insurance.
Oh yeah, that's a great question. So unfortunately, I have heard some cases where Dutch has been covered by insurance. I've heard that with some patients out of Kaiser. Generally speaking, still with most of the functional tests that we run, they will run it through your insurance. But what most people have found is, for example, I'm just going to throw out numbers that are not exact numbers, but if the Dutch test, if the cash price is $500, they might bill your insurance $2,000. And then your insurance might pay $1,000, but you'll still owe the $1,000. So generally speaking, that's what people are running into with these tests, which is then you end up actually having to pay more than the cash price. And then if later you say, hey, can I just switch it to cash price? You can't. And so I actually ran most of these tests on my own through my insurance, which was very good, through University of Utah a couple of years ago. And I ran into this again and again and again, also with lab tests as well. So what I would say, things are changing. So I always recommend, check with your insurance company. There are some insurance companies that are covering some of these better, but don't expect it. That's definitely the exception still. Good question.
Great. And another question around the production side. One person remarked that they have low cholesterol and was recapping that cholesterol is an important predecessor to hormone production and was concerned about having low cholesterol and how that might be affecting their hormones.
Yeah, that's a really great question. We think about, I think most people are concerned about having too high of cholesterol and the impacts that has on health. And I think we all kind of understand that in terms of cardiovascular, stroke risk, et cetera. But too low of cholesterol is also super harmful. Too low of cholesterol we're not going to have those building blocks to produce hormones. And then it also is correlated with neurocognitive decline. So why would people have low cholesterol? Sometimes it's not eating enough. A lot of times it's the microbiome and the enzymes in the gut we're not absorbing enough. So that's a really good question, important to address. Any other questions? I think we're at almost an hour here.
Yeah, it's perfect timing. That was our last question.
Awesome. So thanks everyone for joining us. We have another webinar scheduled for November 15th at 10:30 a.m. Mountain Time. And we don't have a topic carved in stone yet. So if there's anything that you'd like to learn about, you can put it in the chat box or send us an email and we'll pick something. Thanks so much for joining us, and we'll look forward to seeing you next month.
All right. Thanks, everybody.